Dr. Milan Javle, associate professor in the Department of Gastrointestinal Medical Oncology at MD Anderson Cancer Center, is offering hope for those faced with pancreatic cancer.
Unfortunately, in most instances, it is diagnosed relatively late because the symptoms are nonspecific because of bloating, indigestion, flatulence, weight loss, diabetes. And when the cancer spreads to other organs, it can lead to pain or jaundice.
Sometimes the symptoms of jaundice can lead to diagnostic tests like CAT scans and ultrasound, which can result in an earlier diagnosis and treatment.
Surgery is the standard treatment for pancreatic cancer if it is diagnosed at an early stage. Unfortunately, this represents only 20% of patients. In most cases, it is diagnosed at an advanced stage, in which case it's treated with chemotherapy, sometimes with radiation.
Hope is on the horizon for pancreatic patients and their loved ones. Dr. Javle is leading a new clinical trial which targets the rapid growth of pancreatic cancer cells. This trial is testing the standard treatment along with a new antibody that has shown promising results in the laboratory.
So, we're really doing pretty well.
Gus Elsener went on the clinical trial to improve his chances of survival and has been on the trial for over 40 weeks.
Oh, my quality of life has been very good. I have a good appetite. I'm not having any side effects from the chemotherapy. I still play golf. I still work 3 days a week, and life is good.
Not all treatments work the same with each patient, so it's important to look at each case individually.
It is believed that every pancreatic cancer has a unique set of genes that makes it susceptible to certain kinds of drugs and resistant to some others. So our hope then is to personalize treatment for patients with pancreatic cancer.
John Howard was told he had only a few months to live after the cancer spread to his liver. He discovered Dr. Javle's trial and became the first patient to try this individualized regimen. 2 years later, Howard explains why it was so important for him to be part of this trial.
I was feeling pretty beat up. I didn't really want to go back on the chemo. I only went on because back on the chemo because my wife asked me to. Today, I'm so glad I made that decision. There's no question it was the correct decision.
Another inspiration was Johnston. Knowing he could make a difference for future generations, he went on the trial. Johnston eventually lost his battle, but not before making an impact in the fight against pancreatic cancer.
My prayer is that with the clinical trials, one day in the very near future, we can hear the word, this person has pancreatic cancer, and we'll look at it not as a fatal disease, but as a process.
Deep breath.
Dr. Javle's research is giving patients more time to live their lives.
Although the average survival of pancreatic cancer is quite disappointing, I tell my patients that although I cannot guarantee that this disease can be cured, we can certainly do our best to improve their quality of life.
John Howard, who is now on a break from treatment, has this advice for pancreatic cancer patients.
For me, when I was able to start thinking about the future, it made a huge difference. And it really doesn't matter whether your future is a month, a day, a year. Just make plans for the future, do what you can, and don't give up hope.